Hi, my name's Martin Hall. I run the pain clinic at Petersfield and my speciality is the SCENAR. Without going into technicalities, what it does is it talks to the central nervous system and gets the body to actually heal areas that are damaged or need any form of sort of healing. The way it works is it mimics nerve impulses, and the beauty of this SCENAR is that every single nerve impulse that it mimics are different from the previous nerve impulses, so the body can't block the signals. It accesses the A, B and C nerve fibres. I think it's possibly one of the only machines on the market that can actually access the C fibres. The C fibres carry somewhere in the region of 75, I think, or 85% of all the healing goodies to an area that needs mending. Consultation consists of probably 30 minutes to an hour consultation. Initial consultation will be a rebalancing treatment, so what we tend to treat is what is known as the 3 pathways, 6 points, and that's 3 pathways down the back and 6 points on the face. What this does is it will help to rebalance the whole body, so that if there's any imbalances there, when we come to treat the person, it's not going to be a huge problem if something is out of whack, because we've already started rebalancing everything. Acute will take a lot less treatments than chronic will take.
Yeah.
But we can do, even if it's just alleviating pain, it is the most wonderful piece of equipment to be able to do that. You put a lot of pressure on your wrists, and I ended up with a calcification of the joint in this area, which actually causes me some pain at times. So what I would do to treat that is, first thing, I turn the machine on. The second thing is, that's the area I'm going to treat. So what I do is I set the power setting. Now, it's very much like you'll feel a whole load of prickling sensations. So it's like a lot of needles. What you want is for that sensation to be comfortable. You should be able to feel the prickling, but it needs to be comfortable. So set it on the same plane and set the power away from the area you're going to treat. So you just turn it up until I can feel that sensation of prickling. Some people obviously will be a lot less power than others. Okay, once you've got that, check other areas just to make sure it's comfortable. When it's comfortable, that's fine. All you're going to do is the direction of treatment of the human body, because the body has a natural spin. So if I put my arms out like that, the body will spin in this direction. So if I'm treating this arm, what I'm going to be doing is I'm going to be treating it in this direction. So what I'm looking for is an asymmetry. So although that area is slightly swollen and there is a calcification, it might not be that area that needs the actual treatment. It could be another part of the area. So what I'm doing is I'm looking for, at this moment, some stickiness, which I've just got here, which is there. So what I'm going to do is find the vector that needs to be treated. So we go down, across, up and back. And it's the most sticky area. It can be sand, it could be a small white spot, a little red spot, it's an asymmetry is what we're looking for, but I'm looking at stickiness at the moment. So down, across, upwards, across again. That's the way to me. So all I'm going to do is brush that area until that stickiness is less than it was originally, which means that we've actually set up a new healing process in that area. Okay, and just keep treating it and treating it and treating it until it's slightly different. And if you can see, it's actually a lot easier to move the SCENAR across that area, which means I've already set up a new healing process for that area. Okay, and that's it. That's all you need to do with it. That can be applied to different areas, different illnesses. If somebody's broken their arm and you've got it in a cast, then you would treat the opposite side. And you would find the area there, again, what you would find is when you're treating it, depending on the spin, you treat this way, and then you find that probably this area of stickiness or the area of asymmetry will correlate with where the brake is on the other arm. Yeah, and if it's painful, you turn the power up to, or the frequency up to 350, which is a sedating setting, and treat that area on 350 with the appropriate power, and that will get the body to release natural painkillers to sedate that area, so you don't necessarily need painkillers.